Solent.
Thank you, Charlotte. The sun has popped out on us here at Bournemouth Hospital this Monday morning. We're live on the road today. As part of the NHS's birthday celebrations today, we thought we'd take the show on the road to the Bournemouth site of University Hospitals Dorset NHS Foundation Trust and we'll just cast our minds back over the last 18 months, look ahead to the future as well and the challenges facing the National Health Service as it comes to term with various kind of ramifications of the pandemic. The person at the helm of University Hospitals Dorset is Debbie Fleming. She's the Chief Executive. She joins me on our park bench this morning. Morning, Debbie.
Good morning to you.
It's illustrious, isn't it?
The NHS 73rd birthday and the sun's about shining and we're in a beautiful part of the world, yeah.
Well, let's start with the pandemic, shall we? There's lots to talk to you about, but how tough has it been for your team over these last 18 months?
I think it's been absolutely ghastly for so many people. There's hardly anybody that hasn't been really touched, impacted in some way by the pandemic. NHS staff were obviously at the front line. Just listening today and thinking back over those early days of the pandemic, and we were also frightened. People were so scared and yet so dedicated and so committed, and seeing everyone coming in every day doing their duty, trying to do what they could to help in very difficult circumstances. I'm just so proud of them. So we're all grateful. We're all grateful to every single member of the NHS, and I'm really proud of my staff.
One of the things that was impacted by it, I mean, pretty low down the list of priorities, granted, but was the merger. As I say, the thing that's created your role in University Hospitals Dorset. October eventually happened after, well, a 3-month delay or years of waiting. What kind of a difference is that going to make for Dorset residents going forward, do you think?
It's a really great thing for local people because as the new University Hospitals Dorset, we are a much stronger, more resilient organisation. We will be better placed to serve local people. It's interesting, in October, we'd had a quieter summer. Things have been really quite nice. And when we had our merger, we delayed it a few months because of the pandemic, but we had the merger the 1st of October. We were all delighted to celebrate that in a very socially distanced way. And then suddenly we had this second outbreak, and it was really, really, really tough for people. So we hardly had time to notice and celebrate, but we did really well. And we're so pleased now to have this organisation with a really strong set of values and some amazing people across all our sites, Christchurch Hospital, Poole Hospital and Royal Bournemouth. We've got staff everywhere who do a fantastic job, and it is a privilege to be their Chief Executive.
Yeah, the challenges that you faced since you came into being, of course, we had a dreadful start to this year in terms of COVID spikes, and now, and we're talking a lot about this today on the show, across the county, 50,000 backlog of procedures and appointments, whether it's breast screenings or orthopaedic surgeries or whatever it might be. How worried about that are you?
So we know that where we've done a fantastic job in maintaining emergency and urgent care, some of the more routine treatments have had to be paused and slowed down. That situation is changing very rapidly. So when I look at the difference between the end of March and where we are now, we're seeing more people coming forward for treatment, which is great because we need people who have got health problems to seek help and get the right treatment and care. But we've made great strides already in reducing the long waiters because our teams are absolutely committed to doing that. So for as long as the COVID stays settled, and it's great that we're not seeing those numbers now coming through into the hospitals, we're all feeling cautiously optimistic about that. We can get on then with the routine and less clinically urgent work. So that's good news.
And talk to me a little about how you're planning to do that, because there's some innovative ideas at play here.
We are doing it in a number of ways. The Think Big project is the thing that a lot of us talk about, but that's actually only one thing. So if I say that there's a package, first of all, we're doing all we can to make sure that everybody on our waiting lists absolutely needs the treatment. That, after all this time, they're still in the same place. Is there any other way they need the help? And some have already had treatment. So a lot of validation. Then we're trying to make sure that all those who need an outpatient appointment or consultation or a diagnostic test, those are quite a lot of people. It's not all operations, it's tests and the lead up to operations. operations. Get through that very quickly. Our staff are doing overtime. We're bringing other organisations in. We're doing insourcing, outsourcing, and lots of extra work. And then we've got the Think Big project as well, which is very innovative, and I'm very excited about that. Using retail space in the way we've learned through the mass vaccine, designed to do high throughput. So, and to make sure that we use everyone's time to best effect, that the flow of the pathway, the patient goes through, there's no waiting rooms in this place, because you expect, come in, get tests along the way, at the end of it you see the consultant, they've got the results, they know what to advise. Fantastic. So and then of course we will just keep doing a lot of work, so our staff will get through it. It has to be at the pace that staff can manage, because they're still very tired.
Well, I was going to ask about that, because it's great to hear that for the kind of the potential patients of the county, but for the staff that have worked so hard and been redeployed into various aspects of coronavirus dealing with, you'll be aware that they may in some cases be quite close to burnout.
Yeah, and we have been very, very clear that staff must take time off, they must rest, they must recover, spend time with friends and family, do the things that make you feel better and begin to bring about that recovery for each individual. It's affected different people differently, and some teams, you were talking to the orthopaedic surgeons earlier, lovely Rob was talking, they were fantastic. They were going out helping their colleagues in all the way they could. They're dead keen to get back operating. In other teams they need more recovery time, and of course it also depends on where there's perhaps workforce gaps. If you're still short of staff in areas, those people are still very, very busy, and we do at times still struggle with some of those gaps in workforce that were there before the pandemic.
I'm conscious of the fact there's lots of things that I want to talk to you about, and time is ticking and you've got a job to do. If we move away from the coronavirus recovery stuff for a moment, and just a little bit about this merger, not far away from us, people will be aware if they drive past this site that there's a lot of building work going on. Exciting times here. Do you want to talk to me a little bit about what it is that building work is going to mean?
Yeah, I'd love to. And again, something I'm proud of in the pandemic is, whilst we were all focusing every minute on doing the right thing for the patients in the hospital, I'd got another team who were spending time making sure that nothing slipped with our very important strategic programme. So we are working through a programme. It's so exciting. We're going to have all of our sites are being developed. The Royal Bournemouth will be the major emergency hospital. Poole Hospital will be the major planned site, and Christchurch Hospital continuing to play a vital role for local people with lots of innovative and important services. We are so fortunate because we've had the capital monies from government to be able to invest to make the changes. Increasingly thinking of that Think Big project, how do you do things differently? You need the estate to change, you need different way of using your buildings. Now with this money we can develop the sites so that they can focus and do that area of work really, really well. So we'll get better outcomes for patients, we will be able to recruit and retain staff better through being a stronger, more resilient organisation, able to offer better career opportunities, and once we've gone through all the changes, it'll be a great environment to receive care, and it will be designed to do the job the very best way that we can.
And the planned finish date for that, coronavirus notwithstanding?
So the changes have already started. So the theatre complex at Poole has already commenced. You'll have seen outside the hospital here we've started clearing way, ready now for our great big new building at the front that will house many of the new services. A new emergency department 3 times bigger than the one either at Poole or at Bournemouth Hospital. So that's all happening now. 2024 will be the first big change. That's when the big new building's open, and we're just currently asking staff to help us choose the name for that building, which is exciting in itself. So that building should open in 2024. We then will move some services into that. That'll be the first real big change that we notice. And then after that, there's some rationalisation between the sites to finish it all and move things around. It's 2026. But that doesn't feel that far away. Time ticks on. 73rd birthday for the NHS. I've been in the NHS 37 years, and it just feels like yesterday when I joined.